It is 12:59. We're going to start here in less than a minute. Little countdown. Thank you for joining us, everybody who's made the time this cold and frigid morning here in Indianapolis. I'm Brian Mitchell, and I have my partner with me, Stan Massey from TrueSpot. We'll be walking you through this in under 30 minutes and then sending the recording afterwards to share with your colleagues. Excited to have you here, and we are ready to kick it off here on time. Thank you so much. Again, Brian Mitchell from Sonicu, and I am with Stan Massey from TrueSpot. We have a unique proposition to share with you relative to healthcare technology. Very excited to walk you through this presentation and help you understand how we help healthcare professionals improve the way they do their work. Stan.
No, I just want to point out, we're not quite in presentation mode. We're in the little slideshow. Perfect.
Is that better?
Oh, it kind of came through. And no, I think the other way would be better. It's in a kind of a tile format.
Okay. Not sure how to get out of this mode now, sir.
Yeah, oh, that's perfect. Excellent, thank you.
Yes, sir.
Yeah, so here's our agenda. We'll be touching on just the partnership of the Sonicu relationship with TrueSpot. We'll be touching on our the problems that each of our organizations solve around asset tracking and environmental monitoring, and how we kind of work together to provide those in a really unique, efficient way. So we're going to hop on to the next slide and just get into the details. So the partnership between our two organizations, between Sonicu and TrueSpot, makes a ton of sense to me. Really, first off, because of our shared mentality. We're both world-class providers in our areas of expertise, and we aim to remain that way. I say that in contrast to so many vendors that we see in the marketplace that try to become all things to all people. Try to provide a lot of solutions through a single offering, dilutes their expertise, dilutes their focus, and in the end, they provide a lot of things in a suboptimal kind of mediocre fashion. That's not what we're doing. We're solely focused on asset tracking. Sonicu is solely focused on environmental monitoring. And so we joined together to bring those two world-class solutions through one single unified technology that we can run off together, one infrastructure with two solutions to efficiently and effectively provide those to you in a cost-effective manner. And we do that through the use of LoRa. Next slide, please. LoRa is simply long-range, low-power radio waves. It's very strong, very benign, and very powerful in such a way that these radio waves will be able to reach out and touch and cover every nook and cranny of your hospital, as well as outdoor areas such as courtyards, helipads, parking lots, parking garages, all without the limitations that we see in cellular and Wi-Fi, where we all know you have experiences of drop calls, hiccups in transmissions. LoRa mitigates those issues with its strong presence that goes through all of these obstructions very well in a way that other technologies just simply can't. So in the end, from TrueSpot side, what we'll ultimately be delivering to you is the ability to sit down at any desk in front of any mobile device, search for a piece of assets, search for your asset, and see a graphical representation and a verbal description of where it is anytime, day or night, at any point.
Excellent. Thank you, Stan, for that brief introduction. From the Sonicu side, it is much the same, right? LoRaWAN is a communicating protocol that allows us to use a single hub that can be stored in a utility closet or in an office or different parts of your building and have it connect both to real-time tracking of your devices and assets, as well as temperature monitoring. What you're looking at here is the floor plan view of the Sonicu software. So just like TrueSpot allows you to find your assets when they're missing, Sonicu allows you to identify very quickly where a troubled fridge or freezer is so you can respond and protect the assets there. We're going to walk through how this works in a couple of slides, but high level in those last two, you kind of saw the end deliverable, what our customers enjoy when they invest in these solutions. Stan?
So every hospital struggles with inefficiencies around their technologies, their assets. Being able to quickly and efficiently find those pieces of equipment, I don't know, the pain points, I guess, to say, around not being able to find those pieces of equipment causes tremendous amount of challenges around hard costs of lost equipment, inefficiencies, and it's the same on the environmental protection side. You know, there's a tremendous amount of products that simply go unused or wasted because of environmental protection issues where they go bad. And those are all easily avoidable through the TrueSpot Sonicu partnership. It doesn't have to be this way. It can be simply available to you, all the information that you need to locate your equipment and to monitor your medications, all available at the touch of a button on your mobile device.
Excellent. So Stan nailed it right there. We know that hospitals are accidentally having things walk away that are expensive assets. They are accidentally losing vaccines or tissue or blood or, God help us, an organ ready to be donated when a freezer fails at the worst possible time. So Sonicu helps solve that with this Venn diagram you see there, where we help people protect their assets with our alerts that come to your phone and computer and email, with our regulatory compliance, the reports that we produce for virtually every regulatory agency, and then the operational efficiency from not having your staff spend time walking around, checking the temperature of every fridge and checking the air pressure in your operating rooms, and then logging all of this and keeping the reports and then using it to compile your stuff for Joint Commission. Right. So that's how we work at Sonicu on top of what TrueSpot does to find and locate your assets when they go missing. There are myriad examples, some of them truly heartbreaking, around temperature loss and how it can impact organizations' bottom line and reputation. This event here in New York from 2023, a cleaner, janitorial staff unplugged a freezer because it was making a bunch of annoying noises. Turns out it was trying to warn him that it was dead, and they lost priceless research, right? Had they had a remote monitoring system, it would have alerted the hospital research staff and not the janitor. And then on the food side, we saw a food company file a $7 million lawsuit because right before their biggest event of the year, the distribution house that stores all of their food had a freezer failure. And again, no alerting in place. And it caused the business to go out of business because it was like their Black Friday when they made all their money and they didn't have their inventory. So there's some real heartbreaking cases out there on top of drug shortages. So this is in the news all the time. It is such a prolific problem. The FDA keeps a daily log of what drugs are and are not in shortage. And then you see the PR coverage that appears in local media when these issues hit your local hospital. Obviously, if you've got a shortage of a drug, the last thing you need is to have the freezer holding those drugs die and you lose stuff that's already in shortage. So when you add the human error, the human mistake part of it, and then these drug shortages, you've got a pretty profound potential for bad things to happen. And on top of that, the money spent on labor, right? Is it smart to spend money having a person walk around your staff at $17 an hour, checking to say that every fridge is at 39 degrees and every freezer is at 17 degrees, when you can install a sensor that would do it all for you, right? So we know the problems are out there on the Sonicu side. We hear it every day from our clients and prospects. We help solve that with a really simple set of sensors and software. Back to Stan to introduce you a little bit more about TrueSpot.
Yeah, so TrueSpot as a company, we've been around for about 8 years. The core group, our founding core, or founding fathers, I don't know, I guess how you'd want to say it. That core group all came from the high tech industry, dealing with cellular networks, wireless technology, all that built that expertise so that when they stepped away and built TrueSpot, and they built this real-time location system, they had all the knowledge necessary to build a wireless uh, network that's going to be highly effective in a way that others simply are not. Track hundreds of thousands of assets across the automotive and healthcare industries, and we've done some really unique things. Uh, so unique that the U.S. government has provided us with multiple patents, and we've been vetted out by Microsoft and seen as worthy of their certification, and they've asked us to participate in their marketplace so that you can purchase us through no directly through us or no depending on your Microsoft relationship. And you might see some benefits to going through there as well.
Excellent. Thank you, Stan. So Sonicu's been around since 2008. We are based in Indianapolis. The history is pretty cool, actually. Our founder, who is no longer with us, sold the company to our current CEO. His son was in the NICU, hence Sonicu became the name. And they were noticing that the children in the NICU, the babies, the preemies, were reacting adversely to too much noise that the nurses were making. So he made a sound monitor that measured the sound in the NICU and alert the nurses when they're making too much noise. That could damage the hearing of these preemies. The nurses turned to him and said, "That's great, but the thing we really need is to measure the temperature of the breast milk in these fridges." So from that is temperature monitoring is born, and we have grown now to tens of thousands of customers in all 50 states, a couple Canadian provinces. We're in Jamaica and a couple other islands down in the Caribbean. So we're truly a little bit of an international company. And like TrueSpot, we have a commitment to being innovative and have high tech in our DNA. All of our cloud is hosted on AWS, meaning we're reliable, secure, scalable, so on and so forth. We've got a core team based here in Indianapolis, who you see. My colleague Clay's got to do a better job of getting his photo up there on LinkedIn. But we've got a terrific team of customer support, of sales, of engineers who come to work every day thinking about taking care of our healthcare, life science, food service clients to give them the best monitoring and compliance possible. Because of that, we've been able to grow and take care of some great clients. IU Health is probably our signature client here close to home, but we're at Ohio University inside their laboratories. We're at several UHS facilities, the IU School of Medicine. We're in Optum, we're in Option Care. We've got a really great crop of customers who rely on us every single day all over the country. Back to Stan to talk a lot more detail about the problems that they help solve with their real-time location tracking.
And so I'm sure viewers here probably feel these problems more acutely than I could ever explain them. But not knowing where your assets are causes so many challenges. Of course, the hard costs related to not knowing where your assets are is that they often get lost. They may walk out the door in the trash, the laundry. They may just walk out the front door with a patient. But then there's also equipment that gets lost inside the building as well. You know, cluttered storage room, gets stuck in a dark corner. Uh, and then there's also hard costs around inflated inventories, where you have a radiology director that can't find a wheelchair. So they just purchase more wheelchairs for themselves, for their department. So rather than taking full advantage of the equipment that we have, we inflate our inventory so that everyone has everything available to them all the time, which isn't the most efficient way to use our capital, right? So research shows that hospitals spend about $3,000 per bed per year just addressing those hard cost issues of lost equipment and inflated, bloated inventories. It adds up in quite a hurry. But in addition to that, there's kind of the soft costs of efficiencies. Every single nurse, every single biomed staff, every clinical engineer spends an hour each and every day simply searching for equipment. The nurse needs a wheelchair to move this patient. Biomed staff needs I need one specific IV pump so I can provide preventative maintenance to make sure that's working well and that we're in compliance with all the regulatory needs. we can help with all those things. So moving on to the next slide. People know that they have a need. Now, this isn't new information. Most people understand that. However, they haven't been able to deploy a system like ours because in the past, looking at other vendors, they found that it to be too expensive to have a solid ROI conversation, or just simply too complex to install. Many systems require IT integrations, new cables and wires and access points in the ceiling. So it becomes an unwieldy effort to put this in. So moving on to the next slide, TrueSpot took a different approach. With those pain points in mind, built a completely wireless system. We don't need any sort of Wi-Fi, no cables, no access points, no IT integrations of any sort. We're completely plug and play, and we share that technology with Sonicu so that we run off the same thing, and we don't cause any additional cyber risk because we're completely off the grid. There's no patient data. There's no way to get to that because we're completely plug and play, separate from what you do. And because of that decision and a handful of others, we're much more affordable than others in the marketplace. Moving on. So getting into some of the details of just exactly what does this look like. We have tags that go onto our equipment, and there's a variety of tags for a variety of applications, and they're all there on the screen. But the commonality between them is that they all emit this low energy Bluetooth signal, and they're all easily wipeable, sanitized, that sort of thing. But they each have a unique feature amongst themselves. So the triangle one, is very small, has a replaceable battery. Now, all of these tags have a battery life of 3 years or more, but this one is replaceable. So at the end of 3 years, battery life starts to dwindle, pop the top off, replace it with a little coin 2032 battery, and you're set to go. One on the right, it's waterproof. If it needs to be hosed down, washed, needs to go through the laundry, you would do that with this. Further down, it's a sticker, almost completely flat, great for big pieces of equipment that have flat surfaces. And lastly, we have a SIM tag, almost. It's almost the size of a SIM card. Very small, easy to place, finding an area where it's not going to be intrusive to those that are using the equipment. It's not going to mess with any buttons or any of the text. You put this in a place where it's not going to get hit, smashed, or damaged. Next slide, please. So they'll send that Bluetooth signal, and they get picked up by gateways. Gateways get spread throughout the facility, and they're really what determines your location. And just kind of like the tags, we have a variety of gateways for whatever your use case may be. Every hospital is different. Maybe every floor within your facility is different and needs something a little bit unique. But in the end of the day, all of our gateways just need consistent power. So we have ones that just plug into the wall, have a little clip that goes over the top for tamper prevention. We have others that need a USB port. It can be plugged into a USB adapter, or what we like to do, what's seen at the bottom, is plug it into a Wi-Fi router that's in the ceiling. If it has just an empty USB port, we can plug into that. Not use any of the Wi-Fi or the technology, but just simply to use it as a power source. It could just as easily be a TV. You can plug it up, attach it to the ceiling, or even hide it above the tiles, completely out of the way. Next slide, please. So you kind of put the network technology together. Now you have the tags there on the left that send that Bluetooth signal every 13 seconds or so to gateways that are on the walls and the ceilings. And they send that information, collect that information, send it to the router. The router is going to be every couple of floors. And in the same token, Brian will get to this, but the Sonicu sensors also send that LoRa signal to our LoRa router. The LoRa router then disperses the information to the cloud, and then the cloud updates your mobile and desktop applications so that you can, at any point, anytime, check on your environmental monitoring as well as your asset location, all through this single network. Next slide, please. Yeah. So for TrueSpot, what we ultimately deliver is what we saw at the very beginning. A very user-friendly, intuitive desktop and mobile application that can provide you information in real time. So the way it works, you simply search for your equipment up at the top. It'll provide you the results on the side, as well as a visual representation of where your equipment is, as well as a verbal description saying, hey, it's on the second floor near the labor and delivery. it will let you know that level of information. And then you can filter and sort by department. All manner of things are available through the desktop and mobile application. The best and most interesting feature, I think, of the mobile application is MODAR mode. It's a proprietary technology that we built for ourselves. It means mobile radar. And the way it would work is, let's take in the pictures on the screen. Let's say you want that thermometer on that first telephone. You click it, and it takes you to the second phone screen there to say it's on the second floor in the critical care unit. But you get down there, thermometer's small. Maybe you don't find it. You don't see it. Maybe it's been kicked under a bed. Maybe it's in a drawer. You don't know. You hit the green button labeled Find Asset. That resets the tag. So before, where the tag was sending a message to the gateways on the walls and the ceiling, this tag is now going to send a signal directly to the mobile device in your hand every half second. And you'll start playing this game of hot or cold, just like when we were kids. And as you get closer to your asset, that ball on the final screen is going to start to drop and the signal strength will change such that you'll know exactly where it is. That I won't just be able to tell you that it's on a desk. I'll be able to tell you whether it's on the left side or the right side of the desk. So this type of technology, again, proprietary to TrueSpot, and very helpful for, of course, scenarios like this where it's just hard to find, or a crowded warehouse where it's cluttered. But where it gets used the most as a lifesaver is in instances where things go out the door in the trash and the laundry. Because you'll get notified to know that those things are there, but no one wants to go through a dozen bags of soiled laundry to simply find one piece of equipment. And infection prevention doesn't want you doing that either. So what you do is you'd be alerted to know that something is in an area that doesn't need to be, such as the laundry, and you'll separate those bags. Let's separate those 12 bags of laundry and switch to MODAR mode and approach each bag individually until you know exactly where it's at and you can go directly to it and not spend your afternoon digging through things that we'd rather not. Next slide, please.
Excellent. Stan, that's a fantastic overview of how the Sonicu and TrueSpot technology can be integrated through that hub. Again, you see the Sonicu hub, you saw earlier the TrueSpot hub. Doesn't matter which hub you use, it will allow that LoRa communicating protocol, separate from Wi-Fi and cellular, off your network, easy to deploy, no patient information, to be leveraged for this use. For Sonicu, we also have a few key features in both our hardware and software that make us an industry leader. On the left, you see those Sonicu meters, those little blue guys called the Duo. What makes them special is they have both onboard battery and data capture, meaning if the power goes out because there's a hurricane and stays out for 3 days, it's going to keep sending data. If the power goes out during that same period, it will, and the network connection goes out, the Sonicu hub can have a cellular backup to keep transmitting data, right? So we've built this solution on the voice of customer who's told us we need a solution so that when the FDA and Joint Commission shows up, they don't want to hear about a power outage that lasted 2 days from a storm, or a power outage that we didn't know about that happened at 2 o'clock in the morning on a weekend when nobody was around. Our systems are designed to survive power and connectivity outages by capturing the data locally and with a backup cellular transmission. So again, really, really robust redundancy built around helping our customers remain compliant with the FDA, the Joint Commission, Board of Pharmacy, so on and so forth. So again, we're more than just temperature. Temperature's our core product in your fridge and freezers for blood and drugs and tissue and plasma and so forth. But in the operating room, we do air pressure differential and ambient temperature humidity. We do water leak detection. We do a very simple sensor that can do patient fridges for a very low cost. We can do occupancy monitoring, right? So when you start tying all these solutions together on top of the TrueSpot sensors, there's a lot of intelligence you can gather about your facility and operations in which you are automating key processes, taking the human element out of it, and being able to find your key assets if and when they go missing. So you've seen a little bit about our hardware, learned what makes it special. Our software, though, is really what people interact with every day, of course. There's several different views. You see on the phone there your typical pharmacy alert when a drug fridge goes out of spec. You see on the right on the laptop our dashboard, kind of giving you an overview of all of the different points of monitoring within a facility. And then the map view, which you can imagine would be essential when things do go bad. It's obviously very powerful to be able to look down from the sky and see exactly where one of your fridges or freezers or operating rooms isn't performing as it should. Again, these are available everywhere and anywhere. We have a mobile app, which is best in class, helps you, just like the TrueSpot, helps you find your asset through a search function and find alerts, respond, snooze, take notes, send it to a colleague. A lot of goodness so that even when you're not in the work location, you can pull out your phone and be connected to your critical assets. And then it does more, the software, than just monitor your assets. It monitors itself, meaning how is the meter performing? How is the hub performing? How is a sensor performing? Right? You can go in diagnostic mode and find out how all of your system is performing and work with our team here to fix issues before they become troublesome. Right? Because oftentimes there's diagnostic issues that we can set up alerts and alarms around that if something starts trending in the wrong direction, you can be alerted. Pretty powerful technology. So again, our software does a whole bunch. This is just some screenshots showing you, all the different ways our customers can interact with our data. And I'll turn over to Stan again to talk about
Yeah.
their software and reporting.
Yeah, so I think that's a good lead in as you start talking about data, because when I say the TrueSpot, it starts with location, but that's not where we want to end. We want to be able to show you where your things are, but we also want to help you make better decisions so that it's not just an asset finding solution, but more an asset management solution. And a lot of that comes around with our reporting that we provide through Power BI, as we're a Microsoft affiliated shop. So lots of reports available to you to tell you, when something has left the building, gives you those alerts and notifications. Reports around par levels and inventory levels in particular areas, whether that's par levels within your facility or even between facilities if you have associations with other, multiple facilities within your system. Well, I think one of the most interesting reports that we have is the history report. So if something did leave the building and you wanted to kind of backtrack and kind of do a diagnostics to see where was it before it left the building, and maybe there's some training or some best practices that we can put in place to prevent that in the future, you can pull this report and see everywhere it's been in the last 2 weeks. And then go back and kind of diagnose, okay, well, this is where things went wrong. This is the department that needs a little bit more education. But you can also use this report for utilization, because we're seeing where everything was for the last few weeks, and you can sort it by duration. So when that radiology director comes to you and says, hey, I need to buy another wheelchair because I can never find one, you can pull this report and say, you know what? We don't need to buy another wheelchair because I found one. It's in the storage room and it hasn't moved in 2 weeks. So perhaps we don't need to buy more. We can just utilize the things that we have more effectively and efficiently than we have in the past. And next slide, please.
So Stan, thank you for that. It's obviously when you put these two systems together, I don't think it's a stretch to say, even a smaller mid-sized hospital can realize significant savings, right? We know that our customers do a better job of protecting their assets, cold and frozen assets, and not losing drugs when a freezer dies. And we know from the real-time location tracking that it's pretty powerful to catch an item before it walks out the door from a unloyal employee, or and accidentally ends up in the trash or in the soiled laundry, right? And we achieve all of this through these complementary technologies that all use this LoRa communicating protocol to make it simple, secure, and scalable to capture data across your organization and put it in a couple of simple dashboards, first in Sonicu, second in TrueSpot, and to get greater visibility, accessibility, and insight into your operations. So we got a unified technology, and ultimately that is going to empower hospital personnel to do their jobs better, right? To spend less time taking down temperatures, to spend less time looking for lost wheelchairs, to spend less time um, completing compliance reports, to spend less time wondering if this wheelchair is used one day a week or every single day of the week, right? So there's just a ton of ways this is going to help your staff perform better with better data at their fingertips. Stan, I'll leave it to you
Yeah,
to
I think
close
you
it
made a
up.
good point there that this can be a solution for all sizes. As mentioned in the past, costs and the complexity were so outlandish that technologies like this and solutions like this, they were really for just the mega tankers in the hospital world. It was only the largest systems that could afford to take something like this on. But that's not really the case anymore through the design decisions that we made and the partnership between our two organizations. We have this unified system so that Sonicu and TrueSpot can both combine together through one unified infrastructure to provide world-class service in both areas, where in other places you sometimes have to compromise. You have a great offering in one, but you kind of sacrifice in the other. There's no sacrifices through this partnership. We're solely focused on these things, and we do so in a very efficient way that allows us to partner with you and scale it to you as you grow and move and change and evolve. Our network is easily adaptable to that as well. We can easily adapt and change as you add wings, move departments. With a wireless plug and play solution like our combined offering, that's not a problem at all. It's very simple, very easy to work with. And as mentioned, it's affordable so that you can approach your CFO in confidence, knowing that the ROI can be there with a solution like this.
Excellent. That is our last slide. We will now move back to take any questions. I will check and see if any questions have come in. Yeah, we got a quick one here. Stan, cost. What is the cost of like just at your sensors and the hub if you're thinking about deploying this?
Yeah, I would love to have just a little bit more information from you. So, I mean, I think ideally I would have, if we could get on the phone rather quickly, I could give you in a matter of a minute, kind of a general estimate. But I'd say, our tags are $10 and less, where in comparison, others in the market, their tags are $50 and more. And their sizing, part of that I'd say is like, here's a label around tags from one of our competitors are rather large. Our tag is rather small. And so part of it is just really around the design decisions that our technology experts took a different approach. And so it became not just more reliable, but more affordable.
Excellent. On the Sonicu side, I know the cost question came to Stan, so I'm gonna step in and talk Sonicu a little bit. Here's our communicating hub that uses the LoRaWAN. This list price is about 500, but most of our healthcare customers buy off a GPO where we've got a significant discount. And then here's one of our more popular sensors that would be used in many applications across a healthcare environment. And this retails for $129. Again, significant discount with a GPO. Any other questions? Hang on, I see one right here. Can the TrueSpot be utilized as an app that can direct guests to different locations within a hospital? For example, the guest can scan a QR code and then select the location they want to go.
That sounds a little bit like a kind of like a wayfinding integration. So we don't have that at the moment. But as mentioned, we're a high-tech company that likes to grow and evolve. And so we've had conversations with wayfinding type, mapping, logistical type organizations. We don't have that in place yet. We're kind of waiting for a hospital partner to be a catalyst that's really looking for that we can build that together. But we look forward to doing that. It's on our roadmap, but it's not in place today.
Excellent. Great question. Good answer. Who gets notified when an asset accidentally, like the accidentally leaves the facility?
Yeah, so that's a good question, Aiken. So there's two ways I would say. So one thing that I didn't take the time to mention was we have proximity sensors. So just like you have at a retail store, if you were to take a sweater out and it has the tag on and the alarm sounds at the door, we have sensors like that as well. So where appropriate, we can put those there. You kind of have to be thoughtful. You don't want the alarm going off every time someone gets wheeled to their car, and being dismissed. But that alarm is great for the trash and laundry areas. But there's also, so that's that immediate notification right there in the moment at that spot. But there's additional notifications that we can put in place around emails and texts that can go out as frequently, it can go out immediately, or it can be scheduled. However, kind of makes sense to you. And those notifications can come in email and text, and it really goes to whoever you designate.
Excellent question. Excellent answer. On the Sonicu side, we have a very robust alerting engine that allows you to set up alerts that says, hey, if this goes out of spec, give it 15 minutes to make sure it's not a false alarm. And then at 15 minutes, send an alert to Stan by email, and to Brian by text, and to Luke by phone call. If no one responds to those in 5 minutes, send it to Bill by text and Rachel by phone call, so on and so forth. So you can build this really complex if this, then that alerting engine on the back end of Sonicu. Most importantly, our customer success team is here to help you do that. So when you want to build out your reporting engine, you work with us and we make sure it's built the right way. And even more importantly, we put a new feature in earlier last year. You can test these alerts. So you can go into the software and hit test and say, okay, does this work? Do people get the phone calls? Do they get the text? Do they get the thing? Does it work through the tree that I built? Our customers love that because in the past they found they had to literally make something fail to test it, to make sure it works. So we've got a testing system inside our software that allows you to validate everything you set up is working as advertised. I see one more question around NIST certification. Are our sensors NIST certified? The answer is yes, they are. And we have a system in place called Snap that 80% of our customers take advantage of, in which we ship you new sensors a month before the certification expires. You plug it in, walk away, and the new certification is uploaded to the software. So when the Joint Commission or the FDA show up, you are good to go from a compliance standpoint. We have no further questions, and we've been here 36 minutes, which is really generous of everyone to share that time with us today. We know there's a lot going on. We had it over lunch, so hopefully you enjoyed a warm cup of soup or something. If you're in the cold climate like I am, I'm ready to go eat something warm. Thank you again for joining us. We will follow up by sending this recording out to everybody. So if you want to share it with other colleagues in your team, and then you'll have our emails and contact information if you want to go a layer deeper into how these technologies can serve your organizations. Again, thank you so much, everybody, for joining us. Thank you, Stan, for being a great co-host.
Thank you.
Be in touch soon. Take care, everybody.
Thank you. Bye-bye.